Hello, and welcome to the August edition of Pulse, the monthly webcast produced by the Indiana State Department of Health to keep Hoosiers informed of events and health trends in Indiana. I'm your host, Matt Scotton. August is National Breastfeeding Month, and our guest is Kathy Detweiler, Breastfeeding and Perinatal Coordinator, here to talk about the benefits of breastfeeding. Good morning, and thank you for joining us today.
Thanks for having me.
You're very welcome. So why should mothers consider breastfeeding exclusively over formula?
Well, we know that breast milk is a superior substance to formula. We know that there's lots of health benefits to breastfeeding. We know that babies that are breastfed have fewer ear infections, fewer respiratory infections, less asthma and allergies. Future state, we also know that they end up with less diabetes and less cancer rates.
And there are health benefits for mom too, right?
There are. We see immediately after delivery that the breastfeeding moms return to their pre-pregnant weight faster. Breastfeeding burns about 500 calories a day, so that helps them get back to their pre-pregnant weight. Also know that the oxytocin and some of the hormones help shrink the uterus and decrease the bleeding right away. After that, we also see moms that breastfeed have less rates of ovarian cancer, breast cancer, and diabetes later in life as well.
We know that more than 80% of mothers start breastfeeding, and by 3 months, less than 36% are still exclusively breastfeeding. Babies who are exclusively breastfed receive the greatest health benefit. Are there any guidelines that mothers should keep in mind to help them breastfeed more successfully?
We don't want to make it a lot of rules, but we do have ABCs too. We want to make sure that we are aware of the baby. The baby will tell you when they're hungry. They kind of smack their lips and put their hands up and try to eat their hands. That is an indication that they're wanting to feed. Then the next thing is to be patient. Some babies eat very efficiently and some babies take a little bit more time, and that's normal. We also want you to be comfortable. We want moms to know that the baby should be well supported, but it shouldn't be painful. If it's painful, it typically requires an evaluation of a lactation consultant or somebody that's trained to evaluate a feeding to help figure out what's going on.
Now, I understand you're working on a partnership right now with Safe Sleep Experts. What can you tell me about that?
We're working on ways to recognize those hospitals and facilities and healthcare providers who are working towards all the best practices and recommendations for both sleep environments and feeding. So we think that if we can combine the efforts of optimal feeding and safe sleep, we can really work to reduce infant morbidity and mortality in Indiana, which we need to.
Great. Well, thank you again for joining us.
Thanks so much.
To learn more about National Breastfeeding Month, visit the United States Breastfeeding Committee at www.usbreastfeeding.org. You can find a link to this website as well as the Indiana State Department of Health site for breastfeeding information and resources below this video in the comments section. Until next month, thank you for watching the August edition of Pulse.